identify in mothers as well as in neonates, thermoregulation, prevention of infection, and various screening tests. Apart from that, in for preterm neonates, we are teaching them, we are counseling them regarding expression of milk, milk handling and storage. We are also telling them about oromotor stimulation, KMC, baby massage, and discharge health teaching. Discharge health teaching is how they have to take care of a baby at home, preterm baby at home. So if now we will talk about some challenges. So broadly the challenges can be divided into physical and clinical challenges related to the mother, psychological and emotional challenges related to the mother, and social challenges. So talking about physical challenges, there are certain if we talk about mothers in the initial days, so all mothers will be all the mothers that we counsel, we come across, most of the mothers have this problem of that they are not having adequate milk output in the initial days. So in this situation, we are counseling mothers to just frequent suckling by their baby on the breast, frequent expression, and building their confidence that it is going to get better with time. Then because of some reason, if the baby has been fed with spoon during the initial days, so it becomes difficult for the baby to take breastfeed. So they refuse breastfeed. In that cases also, we counsel them to offer their breast whenever the baby is ready to suckle, and at that time they should keep on continuing with spoon feed. Then there are certain, so one of the main problem, one of the basically poor attachment is the cause of almost all breastfeeding problems. If the baby is not attached properly to the breast, then there are a lot of problems that the mother faces, and the key to successful attachment is positioning. So during our lactation rounds, we counsel them and we demonstrate to them various breastfeeding positions, and the position in which the baby and the mother is comfortable, that position is reinforced. So the conditions that while breastfeeding, certain mothers have certain breast conditions like inverted and flat nipples, soreness of breast that is due to cracked nipples or nipple fridges. In all these cases are we manage these cases by building mothers' confidence, telling them about different various positions, giving them providing them with electronic breast pumps and expressing and giving. Now certain conditions like breast engorgement, when there is excessive milk, and in worst cases like blocked duct and mastitis, these cases they are managed very promptly, and if in case abscess formation is there, we refer them to the surgical unit for surgical intervention. Then babies with cleft lip and cleft palate. This is a congenital malformation in which the lip and the palate has not been formed fully. So the type of feeding that we get, the mode of feeding in this depends upon the defect of the baby. So if the defect is small, so direct breastfeeding is promoted. Otherwise, as Harminder ma'am told you, there are palates. And in larger defects where these cups can lead to aspiration, we prefer using long teeth nipple bottles. But when we are using nipple, we make sure that they know everything about the sterilization of the equipments. So these were the physical challenges. Now coming on to psychological and emotional challenges. See, the postpartum period, it takes a toll on the mother's physiological and emotional well-being. So mothers, because they have become like lack of confidence in a new mother, and exhaustion, sleep deprivation because of the feeding schedule, all these things lead to leads to psychological stress to the mother, anxiety. Sometimes mother may end up in postpartum depression, and in worst cases postpartum psychosis. So in order to relieve their what practices, as Harminder ma'am already told you, we have spiritual sessions, we have yoga, spiritual sessions daily, yoga sessions weekly, then mothercraft classes to educate the mothers how to take care of the baby in the hospital as well as when they go back home. And we kind of distribute booklets. We have informative booklets, and we distribute the booklets to mothers so that they can read it. It is in the local language, whatever they understand. Usually we use Hindi, Punjabi and English. Then because the mothers, babies who are admitted in the neonatal units, their mothers have a chronic stay in our unit. So they are away from their home. So we try to make them feel like home. So we celebrate festivals along with them with great zeal. And then we have a dedicated neonatologist parent interaction time for sick babies. So the parents whose babies are sick, they can come to the neonatologist and they can have ask their concerns on queries, whatever they have regarding the health of the baby. Then in case if some mother develops postpartum psychosis, postpartum depression, so such patients are referred to the psychiatrist. So as these mothers are discharged from the hospital, they are staying here in our mother room. So if they have any gynae related issue, that is also addressed within PGI only, because we have a gynae resident that is posted in our unit every month.